Hi, this is Dr. Fred Maese. So today is a short presentation that details a little bit about my background, my training, and my approach to my medical profession as an internist and as a cardiologist. As most of you know, I was born in Mexico, spent my first 11 years living in a beautiful place with family, grandparents, and then was taken to Canada to go to school from the age of 12 till the age of 22. Why was that? Because my mother was a brilliant individual who had a master's and a PhD on behavior modification of the addictive personality behavior, and so she was granted immediate Canadian residency to do research at the prestigious University of Toronto. So I grew up in Canada with very Northeast and Anglo type of influences. Then I ended up going back to Mexico, where I studied at the University of Monterrey, medical school there, 7 years, and we focus on clinical medicine. So I learned how to be a medical detective. I had wonderful teachers, wonderful rotations through the various public hospitals in Monterrey, and was exposed to medicine, all aspects of it, including delivering children, working as an assistant to a surgeon in a small town about an hour east of Monterrey, and performing every type of activity in the emergency room, in the ICU, and in the operating room. Of course, as a student, backing up very able medical doctors and surgeons. This was not focused on technology. We didn't have all the technology available. So we have to use our five senses. We have to become very tuned in to our patients' needs by listening to them, by touching them, by hugging them, by giving them reassurance that they're going to be okay, and by being honest when the situation was difficult. When I came to the US, all new technology was available to us. I went to Baylor College of Medicine to do my internship back in 1990, and immediately I was thrust upon the ICU during the HIV epidemic. My first 6 patients were all intubated patients with various stages of their HIV or AIDS disease. And then I rotated through the emergency room. That was my second rotation at Benton Hospital, which is a public hospital in Harris County in Houston. And it's a very busy hospital where you get exposed to every type of pathology and disease that one can encounter. Years later, when I was chief resident at Methodist Hospital in Houston, Texas, which is a very prestigious institution, the largest hospital in the United States, I asked my boss, Dr. Edward Lynch, why did you put me in the ICU at a public hospital, Bentop, for the first 6 weeks, and the subsequent 6 weeks, you put me in the emergency room at the same hospital? He said, I knew where you came from. I knew you came from Mexico. I knew your background, and I knew you had touched thousands upon thousands of patients of real clinical experience. And unfortunately, I cannot say the same for many US graduates from various medical schools, some of them from the Northeast, very prestigious Ivy League universities. They had not touched very many patients. They didn't have your experience. They were more observers. Yes, very book smart, but lacked the clinical experience that I needed from someone like yourself. So I saw that in you, and I knew you could do it, even though I was aware that you had never managed ventilators or put tubes in people's chests. But then I had. The Mexican experience was extremely valuable into making me who I am today. So my approach for First Health Medical and Cardiology is that I am a medical detective. I like to take an interest in someone's health, in someone's medical history, and putting all the pieces together. Technology is an adjunct. It does not replace the senses that we develop clinically to create a differential diagnosis when someone comes to us for help, especially in complex cases, which are some of the ones that I see because I practice internal medicine, which involves all the internal organs, and also cardiology. I was chief resident of internal medicine at Baylor College of Medicine in Houston, Texas, which was a wonderful experience. That also gave me more insight into how to approach difficult cases, because I had to put every day the morning report and then the medical grand rounds, and of course we had to discuss complex cases. And so as the years have gone on, 30 plus years later, I've learned how to be a medical detective, just like Sherlock Holmes. And so when looking at a patient, when talking to a patient, my senses are attuned to their needs, to how they feel, to their symptoms, to what can possibly help them. And we create gradually together a differential diagnosis. Tests are ordered to back up that differential diagnosis, where the test will make a tremendous difference in how we treat a person. And so I'm able to provide a short-term, say 5 years, and then a longer-term prognosis, especially in cardiovascular patients, to determine where they are at first. Are they at intermediate or high risk for strokes, heart attacks, sudden cardiac death, or other complications such as heart failure? And how I can change that curve by gradually controlling the risk factors that are present in that patient by providing kind education, prudent medications, and appropriate tests that demonstrate the improvement. And then I can hopefully lower the risk for adverse cardiovascular events over the following 5 to 10 years. I have many patients that have been with me for more than 20 years. And they and I have a special bond, because when they came to me many times, it's because they had gone to me for a second opinion. They had been told, please put your life in order. There's nothing else we can do. And then they came to me, and I'm not suggesting here from any arrogant platform that I know more than anyone else, but I do take an interest, and often it's the details. And most of the doctors are extremely smart, extremely capable, but you have to have, beyond knowledge and experience, you have to have the humanity and the sensibilities to allow you to connect with that individual. And most of the time, you are going to be able to do something for them. And I'm not talking about high type of technology. I'm talking about simple things. Explain their lifestyle, what medications are essential for them, what compliance means so they don't just stop their meds, what easy accessibility to me in the clinic in case something arises that they don't understand, to avoid unnecessary ER visits, avoid unnecessary surgeries or other interventions. In other words, you provide the essential functions of a community-based doctor that is a lot more than just prescribing drugs. And so my goal with most patients is to take them from an intermediate or high risk position where if they don't do anything, they're going to have adverse outcomes quickly, to a lower risk where they can truly enjoy a high quality of life and be happy and enjoy their time without having to worry that something is going to happen in the middle of the night and they end up in the emergency room unconscious with multiple tubes in them and not understand what happened. So in summary, I think my background speaks loudly for the person I am today. And I am, in my opinion, humbly speaking, a perfect combination of my Mexican roots, my Mexican cultural influence, my wonderful Canadian years, and the wonderful, amazing opportunities that this country has given me to thrive, and the opportunities that I continue to have to make an impact on thousands of patients every year. Thank you.